What's up, guys? Medic Prepper 611 here, back with another video for you. And the topic of today's video is going to deal with how to properly clean and dress wounds. Unfortunately, a lot of the videos on YouTube that deal with first aid and how to clean and dress wounds fail to properly address this. And a lot of the guys just act like you can go ahead and slap a band-aid or a 2x2 on a wound, no matter how that wound was sustained, and you're going to be okay. And in most situations that may be true, but if you're in a wilderness situation or an outdoor situation, that may just not be the case. Properly cleaning and dressing a wound is a very quick and a very simple task, so there's no reason not to do it in the first place. One of the most basic first aid skills that you can learn is how to properly clean and dress a wound. It should be one of the building blocks of the first aid system that you're learning, and it should be one of the first ones that you learn. The majority of the first aid that you're ever going to administer to anybody, whether it be yourself, a friend, a loved one, or anything like that, is going to deal with minor cuts and scrapes. And like I said, this skill becomes even more critical if you're in the out of doors. If you're on an extended hike, a long backpacking trip, or God forbid you find yourself in a survival situation where something's gone wrong and you find yourself injured. Now, even a minor injury can turn deadly if it's not treated and dressed properly. Now, a lot of you guys probably think this is a gross exaggeration and that I'm kind of blowing things out of proportion, but believe me, an infection is a very serious and real risk and can turn deadly if you do not address it properly. So I'm going to go into a little bit of the pathophysiology behind it right now. I don't want to confuse you guys, but I basically want to explain what an infection is and how it starts. An infection starts when you get a cut or a scrape, and you have dirt, debris, or some sort of microorganism on your skin. Now, that microorganism can be in various different forms. It can be bacterial, it can be fungal, and it can also be viral. And what happens is once this enters your body, it basically reproduces over and over again, and at the same time it releases toxins into your system. So, naturally what's going to happen on any given day is once that bacteria or fungal or virus enters the body, your body's going to release an immune response to try to combat that. And generally, when you're healthy and you're at home on any given day, normally you're sleeping well, you're eating well, you're in good health, your body's natural immune response is going to be enough to combat that. But if you're in the out of doors and you're in a survival situation and you have a lack of sleep, you're extremely fatigued, you haven't been eating properly, and things along those lines, your body's natural immune response is going to be suppressed and may not be enough to combat that. So with that said, it becomes even more crucial at that point to go ahead and make sure you clean and properly dress that wound to make sure that you take those steps to try to clean it out, so what little immune response your body does have will hopefully be enough to combat that infection. And in general, most infections will be local in nature. That means that if you get a cut on your arm, most of the signs and symptoms you see will be localized to that arm. And a lot of those are going to be, pain at that site, redness, swelling, pus buildup, a little bit of a milky discharge, things along those lines. But left untreated, that infection can turn much worse and can actually turn into something called sepsis. And what sepsis is, it's an infection that actually moves into your bloodstream and moves throughout your body. And the signs and symptoms of sepsis actually get a lot worse. They can progress to a very, very high fever, somewhere around the 103, 104 range. You can also have a decreased mental status to the point basically where you become unconscious. You're also going to have labored breathing and a low blood pressure. And if all of those signs and symptoms set in at the same time, your travel is going to be almost impossible. And if you were trying to effect self-rescue out in a wilderness situation, once you get to that point, there's no way you're going to get out by yourself. You're going to need help to get out of that situation. And that is a silly problem to have if you have some sort of a minor injury on your arm and you fail to address it properly to begin with. The best way to prevent an infection is good hygiene. And how that relates to a wound is just properly clean it and properly dress it from the beginning. If you take those steps before you even get to the point of where you wrap that thing up, you really shouldn't even have to worry about an infection. Because you're in the out of doors, you're away from the definitive care of a hospital, and it's best just to try to prevent it altogether. And for the purpose of this video, the wounds that I'm going to show you guys how to treat a wound here in just a second, but the wound we're going to be treating is going to be minor in nature, and it's going to be a small cut or a laceration that requires little bleeding control, and we're also going to assume that this is the only injury that you need to treat, whether it be on yourself or whether it be on somebody else. And we're also going to assume that the injury occurred while on an extended hike or in some sort of a survival situation. Alright guys, now that we got all that other stuff out of the way, I'm going to go ahead and show you guys how to dress a wound. Alright, what we got here, got somebody's arm who has some sort of a minor laceration to it. First step you're going to want to do is you're going to want to expose that site so you have plenty of room to work and you can visually see what you're working with. Now, as you can see here, this obviously is going to be a problem. we have a fully exposed arm. Next thing you want to do is assess the bleeding of the arm. Easiest thing to do, what I like to do, is just go ahead and cover that wound automatically with the dressing, put a little bit of pressure on it. And then what I'm going to do, being it looks minor and I don't see it spurting anywhere, so I'm just going to clean that off a little bit and make sure that we put a little bit of pressure on that right there, okay? So I don't see any more soaking through, I don't see any blood dripping around, so we know it's going to be minor in nature, alright? Next thing you want to do is you're going to want to start to clean that wound. Now there's multiple options available. My first choice is always an antiseptic cleansing agent of some sort, whether it's in a bottle or a wipe form. And always when you start with, anytime you're cleaning that wound, you always want to start on the inside and work your way out, because if you start from the outside and work your way in, you're going to drag all that dirt from around that area directly back into that wound. So start on the wound site and work your way back out, alright? So we're going to put this on here, and as I start to clean, I'm going to clean in small circles and work my way out, and I'm going to clean an area that's twice the size of the area that the wound was in, alright? I'm going to do it once. I'm going to grab another antiseptic wipe, and I'm going to do the same thing in a large area, twice the size of that wound. Alright, now doing it twice, you're going to make sure that you get as much of that stuff off there as you can. And as you can see, even on that second wipe, there's plenty of stuff left on that, alright? Now, after you've got done cleaning the wound, the next thing you can do is apply some sort of a topical triple antibiotic ointment to the to the wound. You get two benefits from that. The first being that you're going to get the medication that's included in that cream, and then the second benefit is going to be that it's going to help any dressing or bandage that you put on that wound to not stick to it. So I'm going to go ahead and apply it to the dressing that I'm putting on here right now. I applied it liberally. That's on here. I'll spread that around a little bit, then I'm going to go ahead and cover the injured area just like this, okay? We're going to keep that on there. It's nice and wet. You want to make sure that the bandage that you're going to put on there is going to be just a little bit larger than the wound itself, so that it covers the entire area and it's nice and covered. And if you're dealing with an injury that's been sustained when you're in the out of doors or in an area that's going to be less than ideal, and you know that there's a possible for secondary contamination from water, rain, dirt, and things like that, what I would always do is I would go ahead and take some sort of a roller gauze, and I would apply roller gauze to this wound as well. Not as any sort of pressure dressing, but as some sort of a secondary protection to make sure that we keep the wound covered and we keep the wound clean. Alright? So you're just going to go ahead and roll this all the way around the arm. You want to go a little bit above and a little bit below that injury. You're not trying to put pressure on it. All you're trying to do is cover that wound and keep any dirt or anything from getting into it. Alright? So we're going to go ahead and roll this all the way around. We're going to go a little bit above it. Just like this. And we're going to get his bracelet here out of the way. Alright, now what we would do is we'd go ahead and cut this right here, and then we would tape that. So what we got the 2x2 on there that would be a non-adherent pad with the triple antibiotic ointment, and then with a roller gauze around it. That's going to provide enough protection to make sure that if he gets his arm a little bit wet or he gets a little bit of dirt on it, it's going to keep that wound clean. And that's the most important thing. In addition to that, I would try to change this at least once a day at minimum. And every time you change out this dressing, go ahead and clean that wound again using the same procedure. 2 times, work from the inside out, and go ahead and apply another layer of that triple antibiotic ointment to make sure that you're getting all those antibiotics in there, and you're going to keep anything you put on there from sticking to that wound. Alright guys, it's going to be the end of the video. If you liked it, please comment, like, subscribe. We'll have more good videos coming for you soon. Take care.